Good evening. I'm Jeff Spence from the Office of Alumni Relations at Thomas Jefferson University, and it's my pleasure to welcome you to this evening's talk. Tonight, our speaker, Maribeth Kradel-Weitzel, will explore the communication design strategies that have been used both historically and today to communicate critical health information and influence public behavior. We'll learn how these strategies can be applied in a pandemic like the COVID-19 crisis or in your day-to-day life. Throughout tonight's talk, we invite you to share your questions using the Q&A button located at the bottom of your screen. We'll address questions at the end of the presentation as time allows. If you don't see the button, try moving your cursor and it should appear. And now it's my pleasure to introduce tonight's speaker. Maribeth Kradel-Weitzel is Assistant Provost for Academic Affairs and is the founding director of Jefferson's new MS in Health Communication Design program. Prior to these roles, she served as an associate professor of graphic design communication for 15 years and was the founding coordinator for our integrative design progress course. Her work focuses on projects that provide equity for vulnerable and underrepresented populations. Professor Kradel-Weitzel, thank you for joining us this evening. The floor is yours.
Okay, thanks for the great introduction. And we're here to talk about designing communications in a pandemic. My name is Maribeth Kradel-Weitzel, and Jeff already did a great job introducing me, so we won't go through all of this. But if you want to take note of my contact information, email is probably the best way to reach me. If as an alum you want to reach out for any reason after this talk and talk to me about anything, I would really be quite glad to hear from you. So I have one slide here where I'm going to talk about the brand new health communication design program, and then we're going to get into the meat of the presentation. So as I said, the health communication design program is brand new. We're actually launching it this fall of 20, and if it sounds interesting to you, we're still accepting applications for this fall. So let me know if it sounds like a good fit for you. But if you're somebody who's interested in what's going on at the juncture of health and design, this might be a good place for you. The mission of the program is to create a healthier world through clear, accessible, and actionable communication design strategies. And it has a really unique structure. I feel confident in saying that the subject matter of this program is highly unique. I don't know of any other programs quite like this anywhere in the world. So the program consists of stackable certificates, which are 12 credit units of content that can be completed within only one semester. So the certificate that we're launching this fall is called Design and Communication for Disease Prevention, Management, and Cure, with a secondary focus on ethics and accessibility. And so within that certificate, students can self-select different topics to work on where they'd like to sort of bring design and health content together. So some sample topics would include infectious diseases, vaccinations, epidemics and pandemics. My, isn't that timely? Substance abuse and addiction, diet and nutrition, so things of that nature, many, many other topics. And then the certificate we're launching this spring is Design and Communication for Life Stages and Identity, with a secondary focus on sustainable systems. And with that certificate, students can self-select topics and things like gender, sexuality, personal identity, reproduction, diversity and equity in healthcare, and many others. So if you complete these two certificates plus a 6-credit capstone, that gives you the full MS degree, and you can do that in only 12 months, or you can extend the time onto a part-time schedule. The program is very customizable and flexible. It's designed to be friendly to students who may be coming right out of undergraduate school, or other individuals who may be working parents, or have very demanding schedules and need that to be accommodated in some way. Along those lines, the program is hybrid, and so that means it's primarily online, but we do have students come together for 3 long weekends of in-person instruction. So really, you can live almost anywhere, but if you're willing to come to Philadelphia for 3 weekends a semester, this program might still be a good fit for you. So if you're interested, the website is jefferson.edu/healthcomdesign. So I hope you will check it out. Okay, so let's get into it. So this presentation has 5 different sections, and really the goal is to provide insights, inspiration, and advice on each of these topics from a designer's perspective, with the idea that these concepts may be applicable to a wide range of disciplines, whether or not you yourself are a designer. So the presentation is going to run about 35 minutes, and then we'll have time for Q&A afterwards if anyone wants to chat. So the first section, we're going to talk about language. And the initial topic I want to talk about is the importance of selecting pronouns. So whether you're using language within a design piece or just, straight writing, you don't have to be a designer to need to know about the importance of pronouns. And so really what I want to draw to your attention is when you're talking about things relevant to the coronavirus or other health issues, thinking about using terms like, third person things like they or people versus, first or second person pronouns like we or you, and the very different results that selection between those two sides of pronouns can create. And so my recommendation and, the recommendation of a lot of experts is that if you're looking to create agency and looking for people to feel like this content really relates to them, you want to say you or we. So you may spread the virus, please practice social distancing, as opposed to they may spread the virus. That seems like those people over there who are far away. So maybe that doesn't relate to me so much. And if you're interested, the section I'm doing here on language is pretty short, but if you're interested to learn more about language and the coronavirus, there is a really great webinar put on by AIGA, the Professional Association for Design, by Dr. Suzanne Wertheim. So I highly encourage you to check that out. So next is thinking about being specific. In terms of when you're talking about cases. So the recommendation out there is really not to just talk about cases, but to refer to them as, modify it as either known or confirmed cases. And this reinforces that we don't really know who is infected. Not everyone has been tested, and the tests are not always reliable or as recent as they might need to be. Therefore, it's critical to follow appropriate safety measures because you yourself may unknowingly be infected. So just as an example, there are X number of known cases of COVID-19 in the US. Okay, and then the next idea with regard to language is thinking about accentuating the positive. So we know we can take a concept and we can spin it one way or the other. We can talk about do's or don'ts. So I want you to think about this idea of don't spread germs. So here we're expressing it in the negative as something not to do versus an idea of something specific that you can do. Do wear a mask. And the recommendation here, and there's going to be a caveat to it, but if generally when you're talking to the general public, you want to speak in the positive. And there's a great article in Medical News Today that kind of explains why. And they say, positive, gain-framed messages are more effective for the general public who have less knowledge about the subject, feel that healthy behaviors are a choice rather than a duty, and have less firsthand knowledge of the consequences of their actions. Instead, they're more likely to look at the big picture and respond to messages that are framed more positively and focus on what is gained by a certain behavior, such as wearing sunscreen can help your skin stay healthy and youthful. So the exception to this is that if you're talking to highly trained specialized individuals, so if you're talking to health practitioners in the case of the COVID pandemic, the negative actually tends to be more influential with that group. So that is an exception. And then it was really important to me to just touch briefly on diversity, equality, and inclusion as a topic when we're talking about the coronavirus. And so this quote here, it's not exactly about the coronavirus, but I think talks about design and where we are as a society. This article by Debbie Millman called "Rethinking Blatantly Racist Brands is Not Enough" for Print Magazine, just came out this week. And in it, she says, in the history of consumer packaging, there has never been a person of color featured on the front face panel of a product that wasn't racist or positioned as an ethnic product. So I think that that is a pretty strong statement and shows that we have quite a lot of work to do. So especially when we're thinking about, Asian people and how they have been portrayed negatively in the media and in society. A HuffPost article said a group of Asian American organizations documented the surge of racist incidents related to the COVID-19 pandemic, received nearly 1,500 reports of anti-Asian harassment and discrimination over the month of April 2020. So really along those lines, we want to avoid victim blaming, and we consider context in the United States of anti-Asian aggression throughout history in this country. It's really inappropriate to aggravate that. So never ever use the term Chinese flu, and the appropriate way to refer to the virus is the novel coronavirus or the new coronavirus, when we're talking about the virus, and when we're talking about the disease COVID-19. So it's sort of like HIV/AIDS. HIV is the virus that causes AIDS, the disease. That's how we refer to novel coronavirus for the virus and COVID-19 for the disease. And I really had to share what I thought was a really brilliant piece. This was created there's a museum in New York City called Poster House, and they put together this compilation of work from a variety of designers. And this was a great piece that, if you can't read it, says, "Before you point fingers, be sure your hands are clean." Okay, so the next section, we're going to talk about observation and just try to think about how being keenly observant can help you in your work. And I thought it was really important to bring these two terms to light within this topic. So if you're not familiar, pain points and pleasure points in design world, when you're doing research and you see somebody interacting with a product or service or communication or policy or a space, and there's something that causes them some kind of mental or physical discomfort, we refer to that as a pain point. And then conversely, it's sort of the opposite. If something that someone is interacting with something and there's some source of delight, we call that a pleasure point. And so as designers, typically we're looking for pain points as things that we can improve upon, and pleasure points as things that can be leveraged in some way or made even more wonderful. So an example I'll give you of this, I love this pharmaceutical packaging created by Deborah Adler for Adler Design. It was used by Target, and unfortunately, when CVS pharmacies bought Target pharmacies, they stopped using this packaging, and it's a real shame. But the pain point, there's a lot to unpack here. I'm going to just talk about one aspect of this piece, but the pain point that Deborah Adler noticed in her life was that she had grandparents that had the same first initial and the same last name. So there was always the worry that they would mix up one another's medications. And so as a way to solve this, in this new design system, she created these different colored bands so that each member of a family would have a different colored band. And I would not be surprised if this saved many lives. It's a really wonderful thought. Another example of using observation to drive design decisions, there's a really wonderful TED Talk by Paul Bennett, who's the CEO of IDEO, called "Design is in the Details." And one of the examples he talks about is that IDEO was working on a handheld medical device, and the instruction was to create it so that the healthcare practitioner could use two hands on it. But when they did their field research, they discovered that healthcare practitioners were not using both of their hands on the device, because you can see what's happening here. It was much more important for this human connection, this this healthcare worker wanted to hold the patient's hand and was therefore only using one hand on the device. And so then that therefore affected the design of the device. So one thing, like bringing it back to the pandemic that we're in, um, some advice is to think about what are people doing differently now and how does that affect your work? So I have expertise in the field of package design. So I'm going to give you some examples of things that I have noticed that might affect future decisions I make on future projects. So for example, with food packaging, people are washing it now in ways that they never have before. Didn't typically write down a cereal box before I put it in my pantry. Maybe that's just me. People have been making more selections online and using grocery delivery services. People are making purchases less often because the advice is to shop for 2 weeks to reduce exposure to yourself and others. People are looking to get in and out of the grocery store a little faster, so they may be making their selections more quickly. Some stores are limiting how much you can purchase of certain items or even all items. And there's been, I'm sure you've seen all the memes of people baking bread, but people are spending a lot more time making food. So when I think about just one of the observations, I'll take the one at the top, washing food packaging. Um, it's very, very expensive for packaging to be redesigned where, we're swapping out a new substrate or we're changing the shape of a packaging of a package. But if you have something new coming down the pike in the future and you know that another epidemic may come along, or perhaps we're even still dealing with it, you may make different decisions regarding like what kind of material. Are you going to choose something that can be more easily wiped down or otherwise cleaned? Are you going to choose a shape that doesn't have a lot of crazy nooks and crannies that can't be wiped down easily? So that kind of thing can help you prepare for future projects. And so just a few tools to kind of wrap up this section. So when you're trying to think about being more observant in your life and in your work, one idea is to think about doing a task breakdown. And I've seen lots of different numbers associated with this, but the general idea is to sort of take a task that you're doing, such as going to the grocery store. So let's say at a really high level, I think about it where, okay, I get in the car, I go in the store, I pick out my items, I pay for my items, I go home. So that's 5. But we can really break down all those steps into lots and lots of smaller little steps that happen throughout the journey at the grocery store. And throughout all those steps, we can kind of mine those for pain points and pleasure points that we might use to make design changes. Another one is to use all of your senses. And so some people tend to be more visual or more auditory. And the idea is to consciously engage all of your senses when you're doing observation work. When you are observing things and trying to find those pleasure and pain points, trying to divide things that things that are facts, and things that maybe you just feel, because it's really easy to bring bias, unconscious bias into the process. And then I lastly wanted to just share this cool tool. It's from Jump Associates. They're a strategy and innovation firm, but somebody from Jump introduced me to this. It's called AEIOU, and it's an acronym that stands for Actions, Environments, Interactions, Objects, and Users. And it's really just kind of a rubric for categorizing your observations and making sure you don't miss anything. Okay, so on to empathy. So empathy is the capacity to understand or feel what another person is experiencing from within their frame of reference. So the capacity to place oneself in another's position, or put somebody or be in somebody else's shoes for a period of time. And so I wanted to start by talking about something historical. So this is an image of a polio ward at the Haynes Memorial Hospital in Boston in 1955. And so luckily, thankfully, the US has been polio free since about 1979, and I hope it stays that way. In the late 1940s, however, polio outbreaks in the US increased in frequency and size, crippling an average of more than 35,000 people each year. So that's according to the CDC. And a particularly cruel aspect of the disease was its tendency to affect small children. Okay, so you may be thinking, why is she now showing us a picture of Candyland? So Candyland was actually invented by a woman named Eleanor Abbott, and she was a school teacher in a polio ward during the epidemic. And she created this to really kind of give immobilized patients this liberating fantasy of movement. And it was really at the time, even children who weren't ill in the early days of the disease, they were often confined to their home because people didn't know how this disease was spread, and it was very scary. So, giving them this liberating, fun toy, obviously we know that it worked because probably many of us actually have this game in our home still today. Um, but in an article about this from The Atlantic, they state that there is a reason to believe that Abbott was ideally suited to consider polio from a child's perspective. As a school teacher, she would have been acquainted with children's thoughts and needs. And then in 1948, when she was in her late 30s, she herself contracted the disease. Abbott recuperated in the polio ward of a San Diego hospital, spending her convalescence primarily among children. So clearly, she heavily researched the situation from all aspects. And you can see in this 1949 version of the game, you can see the little boy actually has a brace on his leg, which was a common treatment during the polio epidemic. And now this image here is a different way of creating empathy. And this was done in the classroom at Jefferson. These are undergraduate graphic design communication students in my package design class. And here they're working on creating pharmaceutical packaging for a senior citizen audience. And we partnered with occupational therapy, and we really did some work to help the students gain empathy for this audience. So you see on the left a student wearing goggles that kind of mimic different types of vision impairment. And on the right, you see an image of students. We did multiple focus groups with individuals who are actually representative of the age bracket that we were targeting. And so they would have them interact with the prototypes and see if they needed to move or function in a different way. Was the writing legible, and was the design actually desirable or attractive to them? And here are a few examples from that work. So on the left is work by Diamond Braxton for an antidepressant medication. And I remember in the process, it was really valuable to work with the senior citizens on the writing. So having writing that just felt motivating and appropriate. And then on the right, you see an example from an individual named Liza Marino for an anti-nausea medication. And they did a lot of work. The focus groups was really helpful with the legibility of the typography, making the instructions easy to understand. And then if you see that pop out there, it was really, really easy for the audience to take the sample medication out of the external package. Another example of empathy in as part of the process of a project is this particular project, which was called Kindness Wednesday. So this is something that I developed with a group of 7 other colleagues from design and health fields. It was inspired by the United Nations request for creative work that addressed the theme of a kindness contagion during this epidemic. And so what Kindness Wednesday does is it provides tools and expressive vehicles for developing shared understanding. And it's very participatory. So here's an example of one of the tools. It's really to help people come up with ideas of how to be kind. So it's a matrix that on the one axis helps people figure out who they might be kind to and pair that with how they might be kind to that person. So it's kind of a brainstorming tool. But really, this is an example of participatory design. So participatory design, if you're not familiar with the term, sometimes it's called co-design, but it's a design approach or a process that seeks involvement of all stakeholders in co-creating an end product together. And so these are images from the group's Facebook page. And you can see there are things that the creators of this project would never have predicted. But it is really an empathetic solution because it's given the actual users of this vehicle a way to express themselves that's meaningful to them. And so a couple tools when we're thinking about empathy. So something called walk a mile immersion, or you could think of it as spending a day in the life of someone that you're trying to design with. But again, just trying to really get in their shoes in that way. Um, Using all your senses. So I have this here again, but it's a little different than when we're thinking about just observation. So what can you actively do to create empathy and step in someone's shoes, and you use all your senses? So an example of that is Smart Design famously had a designer who was creating something for for a target audience that had arthritis. And so the designer kind of plunged their hands into a bunch of ice water for as long as they could stand it, and then tried to manipulate the device that they were designing. Interviews are a great way to establish empathy, focus groups, and then also just the idea of participatory design. Okay, and then emotional reaction. I could go on and on about this, but I'm going to focus on just one emotion. And if you're an Inside Out fan, you'll recognize this, the Pixar movie. This is the personification of disgust. So I'm going to just show you a couple examples of people using disgust as a driving factor in their design work. And so this is truly disgusting. I'm sure you'll agree. But this is actually, if you're not familiar, it's what cigarette packaging looks like in Australia. It's called tobacco plain packaging, and it's looked like this in Australia since 2012. Australia was the first country in the world to do something like this, and it's shown that studies have shown that people believe that cigarettes taste worse in plain packaging. This packaging increases negative feelings about smoking, and people are more likely to hide or cover up their packs of cigarettes. And here's another example of disgust from a wonderful article that a woman named Aline Holtzworth wrote for Forbes. But really just, these are like, I think they call them cootie stickers, but the idea of putting them on places that are touched a lot, so people are sort of conscious, and really the main idea is to drive people to wash their hands more often. Okay, and then lastly, what I think is the most fun section, breaking the rules. So some tools for this, thinking about the world as your canvas, hacking your tools, and implicit health goals. So I'll explain what each of those mean as I go through this section. So there are places that communications are supposed to go. They're supposed to go in books and billboards and bus shelters and ads and magazines. But really thinking about how can you express yourself in unexpected places. So this is a really beautiful staircase in Italy where there are just all these individual potted plants that have been placed to create this larger mural. And this is a great example. This is called four-edge painting, which was really popular in the late 18th century. But the idea that, yes, pictures are supposed to go inside the book, but why can't I have a hidden picture on the edge of the book? So you can see on the left-hand side, there's a book that's kind of, the pages are spread out a little bit so that a painting could be applied, and that painting would be invisible when the book is closed. This, I think, is a brilliant example of placement of message being so critical to the efficacy of that message. So it says, if this poster were a homeless person, then most people wouldn't even look down. And I think that is incredibly powerful. Moving on to hack your tools. So I wish we were in a room and talking together, because I would ask you if you could tell me how these images were painted or created, but they were actually created with a power washer. And so thinking about approaching things as a beginner would, using beginner's mind. So we know what a power washer does or is supposed to do. It wasn't designed to create art, but that doesn't mean we can't hack it and make it create art. And I love going on those life hack websites. I got all these images from there's one called lifehack.org. And I think that you can really get a lot of inspiration from these life hacks. So one example here is on the left, they're using a dustpan to fill a container that doesn't fit in the sink. And then next, it's a hanging shoe rack to store cleaning supplies. And then next, it's using sunglasses as a stand for your phone. And then last, it's using a cell phone light underneath a water bottle to make a lantern that distributes light better. And so if we look at that last example, I don't know which one came first, but there has actually been a lot of work done that's really helped people's lives substantially. So this is an image it's called the Leader of Light Project. And in the Philippines, 40% of the population lives off less than $2 a day. The rising cost of power leaves many unable to afford electricity. So a simple combination of water and bleach in this bottle, it creates enough light for it's equivalent to a 55-watt light bulb. And really allows, for example, children to play inside during the day instead of feeling like they can't be in the house because it's dark and scary. And then lastly, an example of implicit health goals, which I hope in the future we're going to see more and more of this. But just the idea that even when something is not designed for health purposes specifically, we can implement some health goals in them. It's kind of reminds me of product placement, sort of, but here's an example of how that can be done. So if somebody is using Google Maps and they're not going very far, it's a walkable distance, can the map just automatically suggest walking directions instead of driving directions to sort of encourage that more healthy behavior? So that actually concludes my presentation, and I'm gonna sort of exit out of here. I'm going to stop sharing, and there we go.
Thank you so much, Professor. That was a very informative and exciting presentation. We have a few questions that have come in during the talk, and just a reminder to our attendees, you can submit questions using the Q&A button located at the bottom of your screen. And our first question asks if you could discuss the relevance of task breakdown.
The relevance of task breakdown. Yes, absolutely. So let's say I worked for a toothbrush company, and I was tasked with creating a new product or improving something about the process of brushing your teeth. It's the idea that you take sort of the most basic steps, and then you break them down and become more and more and more specific. And in so doing, you might come up with something that really matters and decreases a pain point or increases a pleasure point. So an example of that might be, one of the steps in brushing your teeth is unscrewing the cap. And maybe in doing that, that process of unscrewing the cap, the ridges are kind of uncomfortable or pokey or something. And so you might develop something that's smoother or with a different texture. So that's a really small example. And they can be small or quite radical changes.
Wonderful. We have a question that I think will be relatable to a lot of our attendees in a variety of industries, but especially those working in healthcare. The question asked is, as a therapist who's currently working out of necessity, I've had to change my communication with families to email, present strategies, gain participation. Do you have any overarching suggestions for adjusting your communication in those formats?
Wait, say the format examples again.
So they've transitioned to email communication, but having to present their strategies and gain participation from their patients through that medium. How can you encourage that sort of shift in communication style? Are there approaches that you're aware of?
Into email as opposed to something more interactive, like Zoom?
Sure, like in-person therapy.
I don't want to go there, to be honest.
That's
I
more
don't
than
feel like
fine.
that's my area of expertise. I don't want to misadvise anyone.
Sure. Absolutely, that is more than fine.
Sorry.
I think that we do have just a question. Oh, here we go. Another question asking if we could just go over the words for the AEIOU slide. Would you mind just
Sure.
one more time?
Actions, environments, interactions, objects, and oh gosh, you're really testing me. I'm gonna pull up the slide real quick.
Okay.
U is users. Oh, users, of course.
No worries. Wonderful. Well, we do have a question asking if this recording or slides will be available, and I just want to share that yes, the recording of this presentation will be added to the Jefferson University Alumni YouTube channel tomorrow. You'll also receive a link in your email from Zoom tomorrow so that you can access this at any time. And just one last question, and we'll let you go, is what do you think is the best approach for healthcare providers to acquire or develop a website? Is there any tips or tools that you are aware of?
Well, work with a designer would be step number one, because I think a designer can really talk you through the process and keep you from making a lot of mistakes that could potentially be very costly in the long run. There are lots of templated websites out there, but I think it's important to understand that the value a designer brings is not necessarily the fact that they know how to use the technology. It's the way to sort of guide you through the process and help you really communicate your message. And that's really a complicated process that takes a lot of time. So you want to pick somebody to work with that you're going to have a really nice working relationship with, and just really just give the project the time it deserves. Don't rush it, would be my advice.
I think that's some great advice. Work with the professionals and do a quality job. Well, thank you again, Professor. This was a wonderful evening, and we really appreciate your time presenting and sharing your expertise with us. For everyone who's attending, we hope that you will join us for our other alumni events as they come up, including the upcoming This is Textile Design webinar series hosted by our Textile Design Department, which will feature alumni, students, and faculty in a 5-part series from July 13th to the 17th. You can register now at jefferson.edu/alumni events. We also invite you to follow us on social media and check out our Future Fridays alumni career tips. Those videos release every Friday through July 3rd and can also be found anytime on our YouTube channel. We ask that you also consider making your 2020 academic year-end gift to support the student experience at giving.jefferson.edu before June 30th. You will have the ability to designate your gift to support the areas of the university and across all campuses that have made an impact for you. Thank you again for participating tonight. We hope that you stay well and stay healthy. Thank you.